Hi everyone, welcome to the next webinar for PSMA Connect. Today we have Rachel Sinclair from Enhanced Therapeutix. She's going to be talking about the value of CBD for your patients and your practice, and we're really excited to start this webinar. So Rachel, I'm going to go ahead and give it over to you if you want to start.
Okay, thank you, Meg. Welcome everyone. Good morning. I'm excited to introduce you to, like I said, the value of CBD for both your patients and your practice. There's a lot of confusion out there, and so I hope that I can clarify a few things today because CBD has such great value for addressing specifically pain and inflammation for your patient, as well as a few other things. So let me just start with the basics. You might be coming to this webinar having some knowledge already, so I'm going to go through some basics pretty quickly and get into some additional points that that will, like I said, clear up some confusion. So CBD is cannabidiol. It is actually one of nearly 100 cannabinoids found in the cannabis family of plants. So there's many different cannabinoids. Many of them are being researched for excuse me, for different medicinal value, but CBD clearly is one that has undergone quite a bit of research through the years. Cannabis actually has two primary species, both hemp and marijuana. There's a lot of misinformation out there, like I said, and cannabis, hemp, and marijuana are terms that have been used interchangeably for different things, and so you probably understand why that causes great confusion. So let's clear some things up. Cannabis is, like we said, a family of plants that has two primary classifications, indica and sativa. When you're talking about the marijuana plant, it can actually be considered a member of either indica or sativa, whereas the hemp plant is only a member of the sativa family. So they really do have different compositions, which I'll address here in just a second. They do share certain similarities, but then they have several distinct differences. If you were to look at them side by side, here's a picture for you. You can see they look totally different as plants. You can tell them apart, but yet you can also tell that they have some similarities in their leaves as well. So visually they look different, but their composition is also very different. So in the hemp and marijuana plant, you have two dominant cannabinoids, the ones that you're most familiar with, THC, which is tetrahydrocannabinol, and then CBD, which is cannabidiol. And these are the two compounds that are talked about primarily. When you look at the hemp plant, it's primarily grown for industrial purposes. There's many different things that are created from the hemp plant. It's been around for many years industrially. But let's look at the composition. It has a very, very low concentration of THC. In fact, it'll have anywhere from 0.3% concentration or less. So we call that a trace amount of THC. Just so you know, I know that you are familiar with THC having a psychoactive component to it or result. So a trace amount of THC would never create or result in a psychoactive effect. So in the hemp plant, you're not going to have that result because it has such a low concentration of THC, whereas it does have a very high concentration of CBD, anywhere from 20% or more. So the hemp plant is primarily composed of CBD. The rest of the plant would be trace amounts of all these other cannabinoids, as well as terpenes, which are other plant compounds that have medicinal value as well. So everything is found at very trace amounts. The marijuana plant is kind of flip-flopped. It's grown for recreational and medicinal purposes. It has a very high concentration of THC, anywhere from 15 to 40%. So it's quite a bit of THC in that plant. Very trace amounts of CBD, 0.3% or less. And then, of course, the rest of the plant, again, is made up of the additional cannabinoids and terpenes at very trace amounts. Okay, so when you compare the two cannabinoids, THC and CBD, again, both of them have great health and wellness benefits. THC interacts or aligns with CB1 receptors. These are concentrated in the brain. So let's just talk real quickly about these receptors. So you have an endocannabinoid system, which is a network of receptors throughout your body. It consists of CB1 receptors and CB2 receptors. CB1 aligns with THC. And like I said, these receptors are all throughout the body except for CB1 are concentrated in the brain. And this is largely why THC induces that psychoactive effect. CBD, on the other hand, interacts or aligns with CB2 receptors. These are found, again, all over the body. They're in muscle tissue, tendons, ligaments, all of your organs. They're also in the brain, but they're highly concentrated in the immune system. CBD doesn't contain any psychoactive properties, like we talked about. But what research has proven that CBD does is it blocks pain receptors, it breaks down inflammatory markers, allowing kind of the healing process for inflammation to take place. It also influences memory, mood, appetite, and sleep patterns. There's a lot going on in the immune system. The 80% of the immune system, as you know, is housed in the digestive tract, and so a lot of things are controlled there. And so there's no, it makes sense that CBD would have an effect on so many different things with these receptor sites being concentrated in the immune system. Okay, there's different types of CBD products out on the market. You have kind of two categories, systemic products and transdermal products. Let's talk about some of the benefits and of systemic products and kind of compare them to transdermal. So with your systemic products, they will provide more of a general health and wellness benefit, and largely due to general absorption through the body, because you have these receptors all throughout the body. CBD will be taken up and utilized all throughout the body. So a general health and wellness benefit. So when you take a systemic product, this is where you have great benefits for the anxiety, depression, because it does help to elevate and sustain mood, appetite, and sleep patterns. You can have a benefit with the pain and inflammation. It's very generalized versus localized, though. But over time, you certainly can have a benefit for that. Your most common systemic product out on the market are called tinctures. These are sublingual drops. I'm sure that you've seen these. A little bit to understand about sublingual drops. You obviously drop them under the tongue. A patient is supposed to hold that product under the tongue for a good 60 seconds or longer before swallowing to give it time to actually absorb sublingually. Unfortunately, it stimulates saliva glands. You kind of get overwhelmed with all that saliva. And so majority of patients will swallow too quickly. So research shows that a patient will typically absorb anywhere from 50 to 60% of the product sublingually into the bloodstream. The rest of it's going to go through the digestive tract and be metabolized. Now, some of that will be metabolized out and you'll lose some. Some of it could be taken up in the digestive tract, obviously. So it's not like you're losing all of it, but you do lose some through metabolism. Of course, you have your supplements and your chewables as well. These are all digested and metabolized through the liver. Again, you're going to lose a little bit, and certainly you're going to absorb some. There's definitely some great products on the market that are recommended systemically, and so you just have to find a good reputable product. But something definitely you'll want to take note of is that there are some contraindications to taking CBD systemically. CBD shares the same metabolic pathway through the liver as anticoagulants and anti-seizure medications do. So when you have a patient that's on those medications, you want to, be cautious on whether or not you're going to recommend CBD. You certainly wouldn't want them taking it at the same time as their medication because it will compete for that pathway. And so in doing so, it would have a potential to slow down the metabolism of those medications. And so just keep that in mind. Make sure that the patient's getting educated, obviously. Then we have transdermal CBD products. So these are absorbed through the skin into the muscle tissue, tendons, ligaments, deep into that joint is the goal. Obviously, majority of people, I would say beyond 40, but probably even at younger ages than that, have or suffer with joint pain, muscle pain. There's so many autoimmune diseases that create musculoskeletal pain and inflammation. So many people are struggling with musculoskeletal pain and inflammation. So transdermal products tend to be much more effective for reducing pain and inflammation of the musculoskeletal system than a systemic product, and that's largely due to the local absorption of that product. We actually have many patients with different types of autoimmune diseases that syndromes that have great results with EndoGeneRX as a transdermal product to manage their chronic musculoskeletal pain. there are a couple of things that are really important to understand about the transdermal product. For it to be effective, it must contain an absorption enhancer, and a lot of products on the market do not. So there are what we call stock products on the market. What that means, or stock formula, what that means is it's a very basic formula. Manufacturers will produce a formula and then they sell that same formula to many different brands. So there are stock formulas on the market that just have different labeling on them, but it's the same formula. And so you'll see a lot of consistency in formula, and most of those do not have absorption enhancers in them. And so don't be surprised if your patients have tried transdermal products and have reported that they don't work, because if you don't have an absorption enhancer in the product, then you don't get good absorption of the CBD through the skin, and it's got to get through the skin so that it then can be absorbed or taken up by those receptors that are in the muscle, tendons, and ligaments. So an absorption enhancer usually is a surfactant, and a surfactant breaks through the skin's natural oil barrier, and that allows the additional ingredients to absorb through the skin. So most of your stock formulas, if you were to start looking at the ingredients of transdermal products, the first ingredient usually is coconut oil, and it's infused with CBD. So that's probably one of the most common ingredients or oil that's used to transport the CBD. So if you think about it, oil on top of oil doesn't penetrate well, and so that would be the need for that surfactant. So don't be surprised, like I said, if patients have said, well, I've tried some transdermals and they don't work. There's several out there that are really premium products, premium formulas that are put together correctly that do work. And when you get a great transdermal product, it does work more effectively for the musculoskeletal pain and inflammation. In fact, when you find one that works and you have great results, and it can really help reduce or eliminate the use of oral NSAIDs or opioids. Through research, CBD has shown to be much more effective than oral NSAIDs. So we just got to make sure we're recommending great products that actually have formulas that are effective and safe, so patients can get the results that they're expecting. There are no contraindications for a transdermal CBD product, again, largely due to local absorption. So as I kind of finalize things or wrap things up, I'll go ahead and introduce you to EndoGeneRX by Enhanced Therapeutix. So this is the product that we have you have access to through PSMA or with a member discount. So I want to kind of help you to understand the difference of this product, as well as the benefits that you have to your practice with this product. So it is a premium CBD lotion. It has a proprietary and synergistic formula. So this formula is a formula that is owned by Enhanced Therapeutix. So this is not a stock formula. You will not find this formula matched in another brand. And you can only receive it through Enhanced Therapeutix. It does have therapeutic levels of active ingredients. So our formula consists of both a botanical and essential oil complex. There's actually 13 different botanicals and 4 different essential oils that are proven to actually treat pain, inflammation, as well as soothe the skin. So there are many different reasons why you could use EndoGeneRX compared to your basic CBD lotion. There's 250 milligrams per ounce of purified CBD, which means that it's 100% THC free, and we do have a third-party lab analysis to show that. And the CBD is, of course, derived from industrial hemp. So this is a 2-ounce bottle, so it has 500 milligrams of CBD per bottle. It does include an absorption enhancer. We use jojoba, which again through research is proven to drive ingredients deeper into the skin. So it's a very effective absorption enhancer. So it's going to allow our product to get deep into the skin, into the joint tissue, which is where you need it to go to really reduce pain and inflammation. And then this last component, I'll just spend a couple minutes educating you on the terpene genetic trigger. This is really a key part of our formula. I like to refer to it as kind of a game changer. This enhances the absorption of the CBD in the body. So once you get it through the skin, first you got to get it through the skin. Now we've got to get it, enable the body to take it up. Everybody absorbs CBD differently. And there's a lot of factors to the absorption of CBD Age actually is a factor. As we age, our receptor sites, they tend to degenerate or kind of go dormant a little bit, so they're just not as effective. And so that definitely can decrease the absorption of the CBD for that person. Your health, the condition of your body, your health, your overall health can affect absorption of ingredients. The depth of the joint, how deep into the body is the joint. For example, the hip joint is certainly a deeper joint than the knee joint. So that's going to make a difference on the absorption. And then also the effectiveness, I would say, the absorption rate is going to determine how effective the product is on the chronic pain. So we definitely need to understand the need to enhance the absorption of the CBD. So there are about 15 different terpenes in your cannabinoid plants. Again, terpenes are found in fruits and vegetables too. They're not isolated to the cannabinoid plants. They do all have different medicinal value. There's one particular terpene, it's called beta-caryophyllene, and it is the only terpene that interacts or influences these receptor sites. So it interacts with the CB2 receptor site just like CBD does. And what it does is it kind of regenerates or stimulates these receptor sites, so it really engages them and allows them to absorb the CBD so much more effectively. So when you're dealing with patients, certainly with chronic pain, when you're dealing with an older population or a person that has a compromised health, you want to maximize the absorption of the CBD. And so having a basic transdermal product compared to a product that has beta-caryophyllene in it, you're certainly going to get a more effective absorption with from the product with the beta-caryophyllene in it because of what it does, how it interacts with that receptor site. EndoGeneRX is also formulated by a compound pharmacist. He's had an extensive career and has formulated over 1,200 products very successfully. And it's also manufactured in an FDA certified plant. What that means is it adds layers of testing and safety measures to our product that other products don't go through. It doesn't mean that the FDA certifies our product. It just means that this manufacturing plant is certified, and so they have much stricter guidelines in their manufacturing processes. So because of that, we have a lot more testing that's done on our products. So we do know that our EndoGeneRX has a 2-year shelf life for both stability as well as efficacy. Comes in a 2-ounce bottle. There's about 300 pumps per bottle. It is not a major dose bottle. It actually depends on the pressure that you apply to the pump. So that's why I say there's about 300. Could be less, might be able to get a tiny bit more out of it than 300 pumps, but that'll give you an idea of potentially how long a product could last for a person. We recommend starting with one pump to cover the area of pain. Unless it's a very large area, like maybe a low back, you might use 2 pumps, but most of your joint areas will cover very well with 1 pump. The product is very, very concentrated, as you can see with all the ingredients. And with the terpene genetic trigger, you don't need to use as much product as what you might think because it's just very, very effective and absorbs very well. Then we also have 4 milliliter trial sizes. So these come in a little jar. Most patients report that they get about 3 to 5 days use out of the trial size. So several applications. They do have to kind of take their finger in there to get some product out. So we recommend that you educate them to use like a pea size of the product, about the tip of your finger. And then when you're using the trials, it's important to use it on 1 joint, not 2 joints, and certainly not 2 sides of the body. 1 joint, and consistently, at least 3 times a day. You can use it up to 4 times a day, but when you're trying a product out and you really want to get a good experience, you've got to use it consistently 3 to 4 times a day on 1 joint for 3 to 5 days consistently, until that trial runs out. Because CBD has a build-up component. It builds up in the body and you get better and better results the longer you use it. But you certainly can't expect that chronic pain is going to be significantly reduced with 1 application or maybe even 2 applications. And again, there's several factors: age, health, size of the patient, how chronic has the pain been. So some people need to use it several more days before they really start noticing a significant difference in their pain, and some people will notice it very quickly. So we really encourage you to utilize the bottles. Patients will get much better results when they use it consistently for a longer period of time, and they give themselves the benefit of that CBD building up in their body. And then lastly, I'll end with this, some benefits to you as a PSMA member, because obviously you do get discounts on products through PSMA. So you can purchase the 2-ounce bottles at $69 a bottle. They do come in a 6-pack. We suggest that you resell them anywhere from $99 to $119, and it really kind of depends on your population that you serve and where you are. We have clinics that are selling us at $99, and we certainly have some that are selling at $119 as well. So we're just trying to give you a range that would be appropriate. $119 would definitely be, top of the market. We wouldn't want you to price any higher than that. And then the trial sizes, they also come in a 6-pack for $42. And then we suggest that you resell those for anywhere from $15 to $20 a trial size. And so these, I would probably suggest that, reserve these for your patients that are very, very skeptical. They really want to make sure, that it works for them before they invest in the bottle, something like that. But keep in mind, depending on the patient, they may need longer than 5 days to really get a significant reduction. Most people will tell a difference within 3 to 5 days, though. And then you also will receive a unique medical professional discount code that you would then give to your patient, and allow the patient to utilize that code online when ordering. So they can order online at either EndoGeneRX.com or EnhancedTherapeutix.com. When they use that code allows them to get free shipping. It also attaches the patient to your clinic or your doctor, however you want us to set it up. And once they're attached to you, they will remain attached to you long term. And so every time they reorder online, that commission flows back to you. So we have both an in-office model as well as an online model. We want to keep your commission from your business flowing back to you. So what I want to do now is turn this back over to Meg and open it up for a few questions. I think we might just have a few minutes for that. And I would love to help you in any way that I can. If there's more information that you need, please let me know. And if you'd like to discuss how to get set up in your clinic with EndoGeneRX, if you're interested in that, I'd be happy to help you with that as well. Meg, are you there?
I am. Rachel, that was great. And I'd just like to open this up to anyone that's watching right now to click on the Q&A or the chat. I can see either way your questions. So we actually have 2 questions right now. The first one, Rachel, if you want to take this. First question is, how long has this product been on the market?
Sure. Yeah, so we launched EndoGeneRX in September of 2018. And however, the foundation of the product, of the formula, I should say the foundation of the formula has been on the market for 20 years as a successful plant-based topical analgesic. And then it was enhanced with a few components, the absorption enhancer, the terpene genetic trigger, and of course the CBD. And so that product became EndoGeneRX, and that was launched in September.
Great. Okay. And then the next question is, where else can our patients find this product? Like Amazon?
No, ma'am. So our product is only sold through medical professional clinics as well as our website. So I am the national sales director as well, and so every single order runs through myself, so I'm able to see every order online, every order through medical professionals, and so this is not a product that you'll find on Amazon or anywhere else. You'll have to. It's exclusive to medical professionals and through our website, and our website is for that online ordering for your patients. In other words, we don't market to the general public, we only market through medical professionals.
Okay, perfect. And I have one more question from the audience. It says, when the patients buy online, what price do they pay? Also, do you have a point of sale display for your office, for the offices? Sure.
So the online price currently is $119, and there is a possibility if the medical professional would prefer that their medical professional code gives the patient a different discount online, that is something that we can work out with them, and that would only be specific to their patients with that
Okay.
code.
Okay.
But currently the code is for free shipping, and so they purchase at $119. And we do recommend a display. We do have flyers for advertising in your clinic that are very colorful and eye-catching to the patient and will draw their attention to the product. We absolutely can provide you with some of those flyers. They work great in an acrylic frame at checkout or even check-in, and we even have them available in a poster size. We also think it's really great to have those available in your patient rooms so that when they're waiting on the physician, they can read that and start asking you questions. It just generates a lot of conversation. And then we also are able to send you empty bottles of the EndoGeneRX to display. You wouldn't want to display a full bottle. You wouldn't want somebody walking off with that. So we have some empty bottles that we can send for you to display at your checkout counter as well.
Awesome.
And then we do have patient flyers that you can send home with them that have your code on it, that have directions on it, how to order online, how to use the product, informational cards.
Perfect. And then actually, Rachel, I have, if there's any more questions, go ahead and feel free to put them in there, but I have 2 questions for you, Rachel.
Okay.
The first one is, you might have mentioned it, I don't recall, but how old do you have to be to use a transdermal product?
Yes. So actually, FDA recommendations are 12 and up. So, and that is largely due to, there's just a lot of plant-based ingredients, a lot of herbs, and so that's kind of the standard recommendation is 12 years and up.
Okay. And so do products that advertise higher quantities of CBD, do those produce greater results as the general population would think?
Absolutely. That is something that is the general population would think more is greater, right? But that's not necessarily true. You only have so many receptor sites, so you do have a saturation point. Your body can only absorb so much at a time. And so that's why with EndoGeneRX, we have therapeutic levels of active ingredients. In other words, this product has consistently produced anywhere from 4 to actually up to 8 hours of pain relief for patients. That is a therapeutic level of pain relief. You would want that from your NSAIDs or from even opioids. You're trying to get anywhere from 4 to 6 hours of pain relief reduction. And so this product consistently produces that. And so why would you want to increase your ingredients more when you're getting exactly what the goal is? More ingredients in the product would probably exceed that saturation point, and then you're going to lose a lot of that.
Okay, awesome.
And the fact that we have the genetic trigger in the EndoGeneRX is another reason why you don't necessarily have to have greater levels of ingredients, because that genetic trigger is helping you to maximize what's already in there.
Okay, and so for EndoGeneRX, would that work well for a deeper joint, like the hip joint, or?
Yes, and actually I love addressing that because you do have patients that maybe have a lot more adipose tissue over their joints, some of their joints, and so you're wondering, how deep is this really going to penetrate? So a person that's larger may need to have more applications of it, not at the same time. I'm just saying it may take more days to keep driving the ingredients down, but it will get, all the ingredients in our product are proven to penetrate the skin and go deep into the joint. So it will get there. You may just have to educate that patient that it will, don't expect great results in 2 to 3 days. You may need to really utilize this for a good week before you're starting to feel a difference in your pain.
Okay, awesome. Thank you so much, Rachel. And also to the audience, I would just like to mention that our PSMA team has personally been using, or some of our PSMA Connect team has personally been using this. This has helped with back pain, I think some shoulder pain, even our member services team, Sandra, she works, or she has carpal tunnel, and she's been using this for 2 weeks, I think. And she's not had to take a leave every night. She's not had to use a brace. She's firsthand as well seen that this work for her. So we're definitely believers here in EndoGeneRX, which is great to be able to back something that we're promoting to our members.
Awesome.
And And I would just like to also point out that if you want to know more about this, you can go on our website at www.psmaconnect.com. You can find the listing for EndoGeneRX and click that big red button that says, yes, please link to vendor. And actually, your information will be sent to Rachel here, and she'll be able to follow up with you and talk with you more about getting you guys set up with EndoGeneRX. Rachel, thank you so much again. I've loved this webinar, and I'm very thankful for this opportunity to do this with you. Thank you all for tuning into this as well.
Thank you so much, Meg.